Hello guys, welcome to Just for Women Africa. My name is Olalekan Amusa and you're welcome to the show. Do not forget to hit the subscribe button. Do not forget to leave a like, leave a comment, tell a friend who knows a friend about Just for Women Africa. Today I'm really excited because we're adding a new segment to our show, health. We realized that we'll be getting a lot of feedback, a lot of emails about women asking about health issues, so we decided to get a resource person on the show. And today we have a new member to the team. I'll allow her to introduce herself.
Hi everyone, so my name is Dr. EvaVera Tetteyfio. I'm currently a health officer or a medical doctor at Kolebu Teaching Hospital. Yeah.
Okay, so Dr. Eva is going to be with us for a very long time. She's going to be, we're going to be blogging twice a week on health issues affecting women. And today we're starting off with an interesting topic. I'll allow Eva to do the introductions. What are we talking about today?
Do you really want to know?
I really want to know.
Interesting topic today.
Okay, so tell our viewers.
One of the common conditions women find themselves in or with in our part of the world, which is uterine fibroids. That's what we'll be talking about today, yes.
Okay, so we're going to be talking about fibroids. Yeah. Okay, so can you tell us exactly what is a fibroid?
Okay, so fibroids are, I'll call them harmless tumors or masses which grow in the uterus of women. And when I say women, there are various categorization of the women. We have women in the reproductive ages, that is women of childbearing ages. They are prone to getting fibroid. So if you are not in the childbearing age, which per statistics is between 15 and 49 years, you are not likely to get uterine fibroids. And when you are in your menopausal period, you really will not get uterine fibroids because you don't have the precursors that will lead to you getting uterine fibroids.
Oh, really? Yeah. So it's not like you have to be from a certain tribe, the color of your skin, live in certain parts of Africa or in Ghana to, we're in Africa. Juju, somebody's doing juju somewhere. And for you to get fibroid.
No, fibroid has nothing superstitious to it. It's just growth based on certain hormones that have been produced in high demand. Okay. And based on sometimes our lifestyle. And yes, genetics does play a role. There's a linkage to your family or your mother or sister having fibroid, to you also getting fibroid. Another thing, there are some conditions that run through the family. So if your mother has fibroid, there's a possibility that you could also get fibroid.
Okay.
So there's a genetic route to it.
Okay.
Yes. And then for African women are more prone to getting fibroid, like 2 to 3 times more prone to getting fibroid than Caucasian women.
Do you know why?
They think it's more of our lifestyle habits that leads to us getting fibroid easily than those at the other side.
Oh, that's interesting. Because I thought almost every woman gets fibroids.
Every woman does, but some are more predisposed to getting it than others.
Okay. So can you tell us, for someone having fibroid, what are some of the symptoms?
Okay, so fibroid comes with a myriad of symptoms. You could either have heavy or prolonged menses, which we medically would call menorrhagia. So some women naturally have heavy menses. Heavy menses mean that within the 2 to 7 days when they see they have their menstrual period, they tend to bleed and change their pad a lot. So some may use like 2 to 3 pads in a day. Others bleed so heavily, they may have to use like probably 4 to maybe 6 pads in a day. And even with that, we would like to investigate to find out why you're having such heavy flows. Is there something going wrong with your uterus or your womb that is leading to you having such heavy flows? But if the flow goes beyond 7 days, that's more than a week, we call that prolonged. Okay. Because medically, between 2 to 7 days is the standard period that a woman is supposed to menstruate for. Anything beyond that is prolonged, and fibroid could actually lead to such a presentation.
So if a woman has her period for more than 7 days, she should be worried.
She should be worried.
Okay, that's interesting. So what other symptoms apart from
So aside the prolonged or heavy menstrual flow, she could come with, you should tell her that, oh, I've noticed my feet getting swollen all of a sudden. Or I've realized that when I urinate, I have burning sensation. Or my menses hurt a lot. Or I have pain during sex. all these could be because the fibroid is growing bigger with time, and sometimes pressing on certain structures along that, just within the same area as the womb is located, and then can lead to some of these symptoms. So some could even come with constipation because the tumor in the uterus or the womb is pressing so much on where the fecal matter is supposed to come out from, and then it could lead to constipation. Okay,
so those are two of them common symptoms.
Yes, so I kind of like boxed the couple in, so but those are the two, and some could also come with infertility, not being able to have children, depending on the sizes of the uterine fibroids and then the location of the fibroid in the womb.
So if a woman is unable to get pregnant, she should go in for a fibroid scan?
She should go in for a thorough scan, a thorough checkup, sorry. There could be a myriad of reasons why she's not able to conceive, not only fibroid. It could be her hormone level, it could even be from her partner.
Okay.
It could even be from how they get intimate as a couple. There are so many things that could lead to infertility, not only fibroids. So there's a need to actually investigate that whole panel for us to be sure that this is the cause, so we can go for this treatment and then pay attention to that.
Okay. So once a woman realizes that she has fibroid, what should she do next?
So this is it. The fibroid is not causing any symptom, because truth is, almost every woman in a reproductive age is at risk of getting uterine fibroids. Now, if it's not causing any of the symptoms I mentioned above, then you can just leave it. Finish having all your children if you want to have children, because these days, not every woman wants to have a child. Yeah. So if you want, So if you want to have, you want to have like 3 or 4 or 2 children, or even just 1 child, just make sure you're done having the size of family you want. Then we can go in and either take out the fibroid or take out the entire uterus to prevent it from recurring. Because truth is, fibroids actually recur. That you've taken it out doesn't mean it won't go back.
Really?
The moment the womb is empty, hey, it comes, hey, you're not doing anything here. Okay, let me visit you, and then it just visits you, gets it. So, no baby in there sometimes is one of the causes of fibroid. No baby in there sometimes one of the causes of fibroid. Amazing, right?
I never knew that.
Oh yeah, it is.
Okay, but you did mention something interesting, which I'm sure our viewers. You mentioned reproductive age. What is the reproductive age?
So the reproductive age.
When does it start? Is it from 9 or 10 or 12?
So per statistic, we put it from 15 to 49 years. That is the reproductive age, or that is the age where women are seen to be in their reproductive ages. Yeah.
Okay. So once a woman has fibroids, does she need to have surgery to take it out?
No, it's not.
Is this something she can live with for the rest of her life, or is mandatory that she has to go in for under the knife?
Okay, so like I said early on, if you're within 15 to 49 and you have fibroid, chances that it could increase in size, or it could body just be there and not do anything, just enjoying its space and its time in your womb, or it could actually cause issues for you. Okay, so either we can do the medical management of fibroid, we can do the surgical management of fibroid. With medical management, because there are certain hormones that actually serve as precursors for the fibroid, we give you medications against those hormones, so that it creates a picture within your system that, oh, you're outside your reproductive age, and then there's a down regulation of those hormone productions, and then the fibroid can shrink over time or reduce in size over time. If you're not comfortable with that, we could do the surgical management. The surgical management either it would go in and take out that fibroid or those fibroid nodules, which we call myomectomy, or if you're done planning your family, or the fibroids have altered the anatomy of the womb, then we could go in and take out the entire uterus to save your life. Save your life. Or there's another procedure called the uterine artery embolization. So what it does,
sorry, can you say that again?
Uterine artery embolization.
Okay. So what is that?
It's just so there are various blood supply to the fibroid nodules. So what it does is that it goes in injects some substances into those arteries and then blocks the blood supply to the fibroid and prevent them from growing bigger over time.
Okay.
So it's also another method we actually can employ in helping to treat uterine fibroids.
Okay. So would you advise women who have fibroids to take herbal drugs?
The truth is, all the medications we take are herbal. But the only challenge we have in our part of the world is we don't know the level of toxicity.
Okay.
And we can't tell the side effects for us to know how to monitor. But I would not recommend herbal medication for any woman because I'm not sure what it contains and what it can actually lead to. Then I'll prefer you come to the hospital, we sit with you, we give you the options for you to choose from, and depending on what you're comfortable with, we go in and then we help you with that management.
Yeah, because it's important to ask that question because a lot of women, not just women, but men too, out there doing taking herbal drugs for treatments, and there are lots of side effects to it.
I mean, I've heard of women using herbs to try and melt or expel the fibroid. And you know, some of the side effects of these herbal medications actually to the vagina, actually, it causes scarring.
Sorry, can you please explain what's scarring?
So it causes injury to the lining of the vagina, and when it's healing, it heals by forming certain tissues, which later it gives them one condition I think I shared some time back with my friends called acquired gynaectasia. That is
in English.
And so when we say gynaectasia means atresia. It becomes narrowed.
Okay.
You get it? Or it's basically like you've cut off the end, the connection between the two.
Okay.
So what happens with that is, naturally they were born with a patent vagina, but because of these herbs that they introduced in them, the patency is altered. So now, if they're supposed to meet with their partner to have pleasure in bed, they realize they now come to a lot of pain and they're not able to have that time like they used to, because now the place has become narrowed and they cannot get in there to have the fun that they would like to.
Does it stop them from getting pregnant?
If there's no sperm going in there, that if you want to get pregnant through the sexual intercourse, there's nothing going in there. There's no way you can get pregnant. Because the vagina connects the external part of the body to the internal part. And the internal part is where the opening is where the internal part starts from. And the outside part is the vagina. So if that place is narrowed or is blocked, and there's nothing going through there, nothing can go in there. Unless you decide to try IVF. But in the absence of that, I don't know how you can get pregnant.
All right. Yeah. Okay. Yeah, welcome to Just for Women Africa show. And today we have, who do we have?
Dr. Eva right here with you.
Yeah, Dr. Eva, with Time with Eva on Just for Women Africa. And we'll be talking about fibroids. So, Dr. Eva, as we round up the show, is there any other information to share with women that in regards to fibroids?
So, people would ask, hey, is there a way to prevent a woman from getting fibroids? Unfortunately, no.
You can't prevent fibroids?
It would recur because you have the precursors for it. Estrogen, progesterone, they are in you as a woman. Okay. So you are at risk of getting fibroids. But there are lifestyle modifications.
Okay, so tell us about those lifestyle modifications.
So lifestyle modification, regular exercise, because as you exercise, it helps to put your weight in check. Obesity is one of the causes of fibroids. Okay. Yes, so regular exercise, which means that don't always be seated at one place doing nothing. Don't be sedentary, that's one of them. So you exercise, no sedentary lifestyle, the meals you eat, high fat diet, some literature says high sugar diet can lead to uterine fibroids, yes. So.
Oh. Thank you for coming on the show, Dr. Eva.
It's been a great pleasure being here with you.
So tell us, what are we going to be discussing next when you come back on the show?
Next, I think we would love to talk about cervical cancer. It seems to be one of the the conditions of women or in women, sexually transmitted diseases in women, that needs to be given a second look as in the country and on the continent as well. There's a need for us to pay a lot of attention to this gynae-related cancer in women and how to reduce the burden that comes with cervical cancer.
Is the situation in Ghana that bad?
Yes, it is. It is. Because there is a lot of screening sites for cervical cancer. There is a lot of testings going on. So most of the detection that are done at the later stage, and women come in with very bad states.
Okay, let's not give out too much information. Guys, you've been watching Just for Women Africa. My name is Olalekan Amusa. Do not forget to hit the subscribe button. Do not forget to leave a like. Do not forget to leave a comment. And tell a friend who knows a friend about Just for Women Africa. And tell them about the time with Dr. Eva on the Just for Women Africa show on YouTube. Before we leave, we'd like to give thanks to our partners, the venue restaurant at East Legon, and to BSR. They make lovely t-shirts. Check out their website at the end of the show. And to the next show, we would like to say thank you. Thank you, Dr. Eva.
You're welcome.
Bye.
Bye. I know, right?